Hello. So, for my final project for Sustainable Healthy Environments, I will be talking about the regulatory gaps of the FDA. So, basically, what that encompasses is in recent years, there's been a lot of talk about the stuff that is allowed into food, cosmetics, medicine that may have adverse effects on human health. But for this project, we're going to be specifically focusing on food. So, for the first part of this project, we are going to be talking about the history of the FDA and how it became what it is today. So, the United States Food and Drug Administration was founded in 1848, originally to monitor the safety of agriculture and agricultural products. What this basically meant is the FDA really only regulated farm and farm work, not medicine and not monitoring the safety of food products as it is today. However, in 1906, the FDA became more of what we know it as today, which monitors medicine and food. The Pure Food and Drug Act was introduced in response to Upton Sinclair's novel, The Jungle. Upton Sinclair's The Jungle exposed the food industry, specifically meat processing and the meat industry, for unsanitary practices. The book left the country in an uproar. I'm not even kidding, in an uproar. They were insane about it. So after Upton Sinclair's The Jungle came out, the Pure Food and Drug Act decided to prohibit 1. Any ingredient that acts as a substitute for the food, 2. Alteration of the food to conceal any damage, 3. Posed a possible human health hazard, 4. If it contained filthy or decomposed substances. The Pure Food and Drug Act not only monitored food, but it also monitored medicine, but the regulations were much more clear about the regulation of medicine. This regulation left some wiggle room for food regulations, and it let a lot of things slip by unnoticed. Foreshadowing. And then in 1938, the Food, Drug, and Cosmetic Act was passed. This act gave way more duties to the FDA than it ever had before. The Food, Drug, and Cosmetic Act required that manufacturers must produce food that is safe, pure, wholesome, and labeled without deception. However, in more modern times, the FDA has been highly criticized. Most experts believe that the FDA doesn't really care about food regulation, and they care more about drug regulation. This could possibly be attributed to large food companies and conglomerates lobbying for them to not care, but I don't know. I haven't done any research into it, and that's a conversation for another time. Even on the FDA website, it's really hard to find any information about food regulations. Almost every single webpage on that website is focused on medicinal regulations and drug regulations. You'd be hard-pressed to find some actually good, comprehensive information on the FDA's food regulations on that website. For the next section of this little documentary, we are going to be talking about the general regulations of food by the FDA. In terms of food, the FDA almost exclusively regulates food additives, and as of 2023, 10,000 chemicals, also known as food additives, are allowed into our food by the FDA. The fact that the FDA even allows 10,000 chemicals into our food is kind of a warning sign to me, and it kind of feels like a testament to the FDA's inability to accurately and effectively manage the safety of our food, especially since a majority of these chemicals have decades or years of research behind them saying that they pose a human health hazard, even at low doses. So how are all of these chemicals allowed into our food? There are two possible reasons that are probably synergistic with each other. Number one is that the FDA is chronically underfunded, and number two is the generally recognized as safe loophole. I don't believe that the FDA is hopefully purposefully letting all of this stuff into our food because they don't care. I think a majority of it is that they are chronically and highly underfunded. According to multiple experts, the FDA has been chronically underfunded for the past 20 years and is consistently asked to do far more than what their limited resources allow. When compared to their sister public health agencies, the CDC and the NIH, the FDA has a fraction of their resources and is expected to meet the same standards. In 1996, the FDA only had 39% of the budget that the CDC did, and by 2006, the FDA had only 28% of the CDC's budget. When compared to the NIH, the FDA in 1996 had only 8% of the NIH's budget, and by 2006, that number dropped to just 5%. According to a news report by ABC, the FDA has been so underfunded and understaffed that they're only re-inspecting food manufacturers every 10 years. How can we trust an organization that controls what we put into our bodies when our own government doesn't even trust them with enough funding? That's just a thought, though. So the second reason why I think the FDA is so incompetent is the generally recognized as safe loophole. The generally recognized as safe loophole is a provision in the FDA's protocol that allows companies to self-report and self-certify the safety of new additives used in food. Over 1,000 additives are estimated to be under the generally recognized as safe clause. This loophole allows companies to decide what gets put in our food instead of the FDA, and they are allowed to put additives into our food with little to no research if it potentially is a human health hazard, without even notifying the FDA. Not only that, but a comprehensive review of generally recognized as safe substances was proposed in the 1970s and was never completed. Likewise, the FDA hasn't reconsidered the status of any generally recognized as safe substance since 1982. Not only that, but the FDA has no requirements for testing substances or action on those substances once they have been identified as a hazard. Not only that, the FDA cannot make companies take their products off of the market. They can suggest it. So basically what I'm gathering from this and my crude summary of this is that food companies are allowed to put whatever they want into our food and the FDA can't do anything about it. Many, and I mean so many, food additives that are allowed in our food by the US government are banned in other countries. So for the second half of this project, we are going to be talking about specific food additives that are allowed in our food by the FDA. Basically, there are two different types of food additives: indirect food additives and direct food additives. Indirect food additives are compounds that are found in food packaging like bottles, cans, and wrappers. Indirect food additives have more of a bad rep and they're talked about a little bit more. Chemicals like BPA have been a major topic of discussion in recent years. BPA is a known endocrine disruptor and has been banned in baby bottles in the US. There are a whole slew of indirect food additives with proven health impacts, but that's a conversation for a different time. What I'm going to be talking about is direct food additives, which is stuff directly put into our food. The first food additive that we're going to talk about is titanium dioxide. Titanium dioxide, also known as E171, is a chemical that is legally allowed in our food by the FDA. In terms of food, titanium dioxide is generally used to brighten colors and prevent UV degradation. Titanium dioxide can be found in stuff like candies, coffee creamers, baking and cake decorations, as well as white sauces like Alfredo and ranch. In recent months, there has been major social media discourse regarding the addition of titanium dioxide into menstrual products, such as tampons and pads. Some studies have found that titanium dioxide in menstrual products has correlated with an increase in polycystic ovarian syndrome, or PCOS. But for this project, we're just going to be talking about titanium dioxide in food. According to a study done in 2021, titanium dioxide was mostly found in candy, specifically chewing gum. It was found that 70.3% of chewing gum was formulated with titanium dioxide. In the EU, titanium dioxide has been recognized as unsafe for human consumption because it was identified as a genotoxicant. A genotoxicant is a substance that can harm or alter our genetic information found in our cells. Because of this, genotoxicants can become carcinogenic as they alter our DNA. The EU designated titanium dioxide as unsafe in 2021 after a requested review of the compound by the European Commission in 2020. The European Food Safety Authority, or the EFSA, found that while intake of titanium dioxide from food was very low, this intake accumulates over time and builds up in the human body. Likewise, they were not able to identify a safe daily level of consumption for titanium dioxide. Titanium dioxide was first approved for use in the US in 1966 by the FDA. It was allowed as long as it did not exceed 1% of the food's overall weight. Titanium dioxide has been shown to be carcinogenic when tested on animals, specifically correlating with an increase in lung cancer. When doing my research on titanium dioxide, I found a 140-page document created by the CDC on occupational exposure to titanium dioxide. I don't know about you, but the fact that there is a 140-page document by the CDC on what to do if you come into contact with titanium dioxide through occupational exposure. But I don't know if that should really be allowed in our food, but that's just my personal opinion. It's up to you. The second food additives we're going to be talking about are nitrates and nitrites. In recent years, scientific discussion regarding nitrates and nitrites has become very, very controversial. Nitrates and nitrites are ions that are naturally widespread in the environment and occur in plant foods like vegetables and water. It has been found that nitrate or nitrite consumption is low through drinking water. Only around 14% of nitrates and nitrites consumed is through drinking water. But the risk is still there. The main culprit of nitrate and nitrite consumption is through food, mainly through vegetables and fruit and animal-based products. Of the animal-based products that contain high levels of nitrates and nitrites, deli meats, cured meats, hot dogs, and cheeses were all found to have very high levels of nitrates and nitrites. Like, have you ever heard that deli meat is really, really bad for you? Or that deli meat has been classified as a carcinogen? That's because of the nitrates and nitrites. Nitrates and nitrites are put into our food to prevent botulism, a deadly foodborne illness, as well as to also add color and flavor. There was a motion to ban nitrates and nitrites being put into our food in the 1970s and 1980s after research coming out of MIT found that it was causing lymphoma in animal testing of rats. And lymphoma is a cancer of the lymphatic system. The motion was shut down in the 1980s by the FDA, which declared that there was insufficient evidence to ban nitrates and nitrites. Nitrates and nitrites in and of themselves aren't harmful to us. But once they're ingested, they can come into contact with other compounds found in our body, and then that becomes harmful to us. Nitrates and nitrites are highly unstable in acidic environments. So when we ingest nitrates or nitrites, where do they go? They go to our stomach, which is filled with stomach acid, which is highly acidic, and nitrates and nitrites are highly unstable in acidic conditions. So what do you think is going to happen? In our highly acidic stomach acid, nitrates and nitrites decompose and go through a series of reactions with things called secondary amines. Secondary amines are substances that are naturally found in our stomach acid and in our gastric system. And through those reactions with the secondary amines, nitrosamines are formed. Nitrosamines are the harmful chemical that people think of when they think of how bad deli meat is for you. Nitrosamines are known carcinogens and genotoxicants and are also found in tobacco products. Decades of research into nitrosamines have shown that it highly correlates with an increase in lymphatic cancers. Nitrates and nitrites are allowed in the US and the EU, and from my research, there are no active motions to ban nitrates and nitrites added into our food. So you might be wondering what we can do to protect ourselves from some of these compounds that are found in our food. Through my research, I would suggest two different things for you. Number one, you can download apps that will scan the barcode of your food and tell you any harmful ingredients that could possibly be in it. One of the apps that I personally use in my daily life is an app called Yuka. You can scan the barcode on any food item or cosmetic item and you can see what additives are in it, and it gives it a rating. So as you can see, the Olipop soda is better for you than the Coke. The Coke has 2 harmful additives. My second suggestion for you is to do your own research. I'm not saying to go on TikTok, go on Facebook, and do your research through there, because there's a lot of misinformation on there, and that's probably the opposite of what you should do. But what I'm saying is read some scholarly articles, read some research papers, and make your own decision whether you want to consume these products. In conclusion, I'm not trying to demonize the FDA. I'm not trying to say that they are doing this on purpose, that it's malicious. I'm just saying that there are a lot of factors that go into the FDA not being able to accurately assess the safety of our food. Also, I'm not trying to say that all of these chemicals allowed in our food are bad for you. Obviously, everything is a chemical, water is a chemical, But I think it's important to critically think about the kinds of things that we are putting into our bodies. And I generally think that the FDA is trustworthy, at least with medicine. So don't be scared of all of these chemicals in your food. All of them you're ingesting at pretty low doses. But just be wary of how much and how often you consume them.